Here at Palm Beach County Fire Rescue, emergency medical care is of top priority for our EMTs and paramedics, and we are lucky enough to have the expertise and guidance of our medical director, Dr. Shepke. Let's learn more today about cardiac arrest.
I view my role as the medical director for Palm Beach County Fire Rescue as sort of the medical expert that brings the latest cutting-edge science to our crews, but it's really a partnership because I'll bring in the ideas and I'll share those ideas with our crews out on the street, and then they'll help me convert the medical science to the best way to apply that science out on the streets. So it's a partnership. Me with the medical knowledge and expertise on one side, and then our crews with the expertise on how to apply that medical knowledge out on the street for our particular patients. So I think together we've been very fortunate. We've had a good collaboration. We've been able to really raise the bar for healthcare in this county.
Rescue 113 dispatch.
Of course, I don't want to leave out our dispatchers, which has been a big help in raising the bar for healthcare in this county. They're certainly part of our team, and they're the ones that really, they're the first rescuer on scene. They give that telephone life support to the folks that are calling in.
One of the goals here at Palm Beach County Fire Rescue was to improve survival rates of cardiac arrest victims. And that was one of Dr. Shepke's goals, to change our protocols to improve those statistics. Let's go inside now and learn more.
Well, it's really important to change those protocols for cardiac arrest. It's one of the biggest areas where EMS can make a difference for the public that we serve. These folks whose hearts stop out in the field, there are better ways than what's traditionally been done to get those hearts started again. In fact, we see that in our statistics. Approximately 40 years ago, it was estimated that the out-of-hospital cardiac arrest survival rate was only about 7%, and that includes folks that suffered brain damage as a result of that. And just recently, a similar estimate came out, and it was still at only 7%, which doesn't show a whole lot of improvement. So that made me take a look and say, you know what, there's got to be a better way, because what we're doing is not working. So I scoured the research for some of the latest cutting-edge stuff, and we were able to put that in play, and we've seen dramatic rise in our survival rates here in Palm Beach County.
Let's learn now why early bystander CPR is so important for patient survival and great positive outcomes. In fact, we're going to get to hear from a local Palm Beach County family as to why Dad's still alive because of his daughter's quick thinking actions. When
you look at cardiac arrest, it's really, we call it steps in survival, or chain of survival is one of the terms we use. And that first link in the chain, or that one of the early links in the chain of survival, is early access to 911 and bystander CPR.
I don't have any recollection of it. I call it my black hole. There's about a 2 to 2.5 week window in my life that I really have no recollection of.
On August 7th, we were a normal afternoon. We were driving home from church, and my dad was driving. My mom was in the passenger seat, and I was sitting behind my dad. And as soon as we pulled into the neighborhood, he pulled off to the side slowly, said my mom's name, and slumped over and went into convulsions.
Okay, what's wrong? What's wrong? And I looked over, and I guess he had said my name. He was holding a cup of coffee, and I saw the coffee cup kind of falling out of his hand, and I put the car in park really quick, and I yelled at Abby, and I asked her to call 911.
Go get help! I jumped out of the car, called 911, ran down the street, checked the street name, and had run back, and by that time, neighbors had come out because they heard us screaming.
Abby just went into action, and I just think she was meant to do that. I put the car seat back because we couldn't get him out of the car, and that was like the best we could do, and she just straddled him and started doing chest compressions. And as she started it, I remember thinking, yes, he needs CPR. Oh my gosh, thank goodness you're doing it.
And just having the bystander, the person who's dialing 911, just push hard and fast on center of their chest can double or triple the survival rate.
My mom looked at me and said, "He's not breathing." And that was kind of where those moments went into a crossroad where I had to decide in those moments that I was going to perform CPR.
I was so grateful for her that she had started, and she had the forethought to do that, because I just was panicked and calling his name and calling for help.
In addition to that, our own local data shows that the folks that have ultimate good outcome with no sign of brain damage. Just about all of them received bystander CPR.
I was just pumping on his chest, yelling at him to live, and just more begging that he would wake up and breathe. And then the police officers arrived, EMTs arrived. They took him into the ambulance, and we waited until there was a steady heart rate.
You know, as soon as the EMTs arrived, I was so grateful to see them, and they took him inside the ambulance. And I can't remember if it was the sheriff that told me or one of the EMTs that they are not going to leave the neighborhood. They're not going to go running off to the hospital with the lights blaring until they get him stabilized and they have a pulse. So we sat and we waited and prayed, and it was what seemed like forever till we heard from the EMTs that came out and said, okay, we've got a pulse, he's stabilized. We didn't think we were going to. It was very scary. We didn't know if he was going to make it, but he's made it.
And then we took him to the hospital, and then it was more whirlwind after that.
What that means is the flip side of that is that if we don't get bystander CPR, then there's a much, much higher likelihood that even if we get the patient back, there'll be some element of brain damage.
It's a moment Nate Bray has been waiting for since the day he went into cardiac arrest in August. Bray now meeting the local heroes who saved his life.
Abby was quite the talk of the hospital, that she had started CPR on her dad so quickly and how important that was. And I realized, you know, how, you know, fortunate we were to have such an amazing daughter to think to do that.
Everyone that we came encounter with, all the doctors and everything and nurses were like, wow, you're amazing, basically. And you know, for me, I was just thinking, like, it didn't seem like such a heroic thing because it felt like just something that I had to do.
So that bystander CPR step is definitely one of the critical links in that chain of survival.
I'm alive because of an amazing chain of people. Started with my daughter here, then I went to the sheriff's department, the fire department, and then the hospital. And without that whole chain working together, I would not be here today.
So, why the big push for hands-only CPR? Let's find out.
Well, hands-only CPR for older children like teenagers and adults is really all that's needed in the beginning part of CPR.
First step, call 911.
And that's because our bodies have oxygen reserves. And it's far easier to teach the lay public to just push hard and fast in the center of the chest than it is to teach them the very difficult skill of opening the airway and giving proper mouth-to-mouth resuscitation. Not to mention the barrier that we have, the psychological barrier. What we find is that they are at least as good, whether you do mouth-to-mouth or hands-only CPR, it's at least as good to do hands-only CPR, and some instances may even be better to do hands-only CPR. Now there's an exception to that.
Hello. What's going on?
Oh my God, she's having trouble breathing.
Children, younger children particularly, and infants, those folks we still need to be breathing for. And that's because the cause of them going to cardiac arrest is different. For them, it's usually because they run out of oxygen, either because of a choking episode or a drowning episode. So we still need to do traditional mouth-to-mouth for our young folks out there, for the young children and infants. But for the older folks, the adults and the late teenagers, hands-only CPR in the beginning is really adequate and quite effective.
So, in addition to more cardiac arrest stories and CPR saves, let's find out if there's been an increase in defibrillator use with AEDs, automated external defibrillators. And let's also find out if technology has played a role in that use.
Well, the use of AEDs is really critically important. We saw in studies dating back to where we put AEDs in casinos that the folks that had AED use had tremendously high survival rates, way higher than the national average, on the order of 70%. Neurologically intact survival, meaning no evidence of brain damage. Whereas you heard, that's what I said before, about 7% total survival in the country. So more than 10 times increased survival rates when there's immediate access to AED for certain types of rhythms. Now, an AED will not work for all types of cardiac arrest, but for the types of arrest where we have to shock the patient, they are tremendously life-saving devices. Fortunately, our community has really responded, and we're starting to have gyms, certain supermarkets, churches, community centers, all placing defibrillators in their locations. And the most important thing of that is to make sure that the folks that are using those locations know where the AED is. So the sequence of events should be really call 911 and grab a defibrillator, turn it on and do what it says. The good thing about technology is now, even with no training at all, somebody can take that defibrillator, turn it on, and the defibrillator will literally start to speak to you and tell you exactly what to do and how to use that life-saving device. We are fortunately getting even better technology. Something called PulsePoint is going to be coming to Palm Beach County very soon. PulsePoint is a social media app, and for those that are willing to help out a victim in cardiac arrest, what will occur is if you download the PulsePoint app, you will be alerted if there is a patient who is suffering a cardiac arrest that needs bystander CPR. You'll be alerted to that patient's location if you are nearby. This will only occur for public locations such as supermarkets and out in other public localities. But in addition to alerting you to the location of the patient that needs chest compressions, it will also tell you where the nearby AEDs are so that another rescuer can grab that while chest compressions are going on. We expect that these technological advancements will further improve the survival statistics for our patients here in Palm Beach County.
Now that you've heard some of the stories here at Palm Beach County Fire Rescue, let's hear how the statistics have improved.
Palm Beach County statistics have improved drastically. The state of Florida, the average percentage of time that fire rescue can get pulses back on a cardiac arrest victim hovers right around 16%. And when we first put these protocols in place, just before we put these protocols, the new protocols in place, we also, in Palm Beach County Fire Rescue, were at 16%. But with all the improvements we've put in place, we have more than doubled that statistic. We're routinely in the 35 to 40%. In some months, we even get as high as 50% return of spontaneous circulation, or basically getting the heart back numbers. So these are world-class numbers, some of the highest in the country, which is really phenomenal and very gratifying. So in addition to the percentage of people we're getting back, just by sheer numbers, let's talk about sheer numbers, we got pulses back on about 100 people in 2014 before we got the new protocols in place. Well, in 2015 and 2016, we saved an additional 130 to 150 people. So we're getting around 230 to 250 people per year that we get pulses back on. The cardiac arrest rate is staying about the same, but shows that we've really more than doubled the folks that we can give a chance of good survival to with our new protocols, on an order of magnitude of 100 to 150 extra lives saved per year.
As community outreach efforts and events have increased awareness for bystander CPR, let's see how this has also helped our statistics.
So we have a number of initiatives in this county that really help to increase the bystander CPR rate and improve the cardiac arrest survival rate in this county. And the first is our hands-only CPR initiative. We've been doing that for 5 years now, and it's really a collaboration between multiple agencies. The Palm Beach County School District with their medical magnet programs, the Palm Beach State College EMS Academy, the HCI EMS program, American Red Cross, and others have collaborated so that our fire stations are open up to the public the second Saturday of February every year for the last 5 years. And now the public can come in on the second Saturday during set hours of February, for the second Saturday of February each year for set hours, to learn hands-only CPR. And they are trained by these high school medical magnet program students who have been taught as instructors in hands-only CPR. So this is really valuable to increase the reach of the number of folks in our county that know how to do CPR and are willing to apply it. In addition, the PulsePoint app that's coming to Palm Beach County very soon will allow those who are trained in CPR to be available as lay rescuers for those that are in cardiac arrest. So if 911 is called for cardiac arrest and you happen to be a person with PulsePoint on your phone will ring and tell you that, hey, there's a patient that needs to get hands-only CPR nearby you, so you can arrive and start supplying that life-saving treatment even before fire rescue arrives.
Those of you that have not taken CPR training, come on in and you'll find out why the song is on.
So media coverage is also very important. Unfortunately, there's been a number of events such as American Heart Walk and others where our efforts at improving community outreach in terms of having our community learn hands-only CPR have really started to spread the message. Other things such as the Sudden Cardiac Arrest Foundation and other survivors organizations have really started to get that message out that, hey, you know what? Cardiac arrest is a survivable illness. It's one of the biggest killers of Americans each year. Sudden cardiac arrest strikes people of all ages, from children all the way up to late adulthood, and every age in between. Then these folks go into sudden cardiac arrest. This is not a heart attack. The heart just simply stops. And these are viable people that if we get good bystander CPR, early 911, early access to a defibrillator, plus the expert EMS care and expert hospital care that we have here in Palm Beach County, we can save a whole lot of these people.
Are you convinced yet how early bystander CPR can save lives and mean the difference between life and death? If not, Dr. Shepke has a few more words for you before we leave.
One of the important messages I want the viewers to know is to learn CPR. And that's because if you are not in healthcare, if you ever have the opportunity to actually use CPR in your lifetime, statistics show you won't be using it for some stranger. You're going to be using it for a loved one, a family member, a friend.
Just the smallest thing as watching a show or anything, like just absorbing those things, it can help save a life. And that by taking a CPR class, even if you use CPR once in your whole entire life, you save a life, or you could save a life.
I mean, we're very focused on the physical heart, the blood, and all those things, but there's a real mental and emotional part of this that is a real challenge, because that's been I think my biggest hurdle has been the mental and emotional part of getting back into life.
I would like people to know that it's so important to go back and thank the EMT team that rescued your loved one, and to go back and say thank you, because it's important for them to see you know, what they have done to impact your life, and to have that moment to just say thank you to them. It means so much to them, and it'll mean so much to you.
Because the people that you spend most of your day with, those are the most likely people that you will have the opportunity in your lifetime to use CPR, and you can double or triple the chances that you will get them back if you then learn bystander CPR and use it when that event occurs. So it's very important for the people you care about to learn CPR.